Hey guys, my name's Emily, and today I'm going to be chatting with Kristine, the head of Lumino Health. We're going to catch up on virtual healthcare, specifically what it is and why it's important for Canadians right now as more and more of us continue to self isolate. Let's find out what Chris has to say. Thinking about healthcare and in general right now, can you just back it up a second and explain what exactly is virtual care?
So virtual care is really, it's just healthcare, but it's delivered remotely through technology. And that can be text, audio, or video. It's how a patient can connect with their healthcare professional when they aren't in the same physical space.
Okay. And why, in your opinion, is it in the spotlight right now?
Yeah, it's interesting. It's gone from what I would have called a nice to have to an absolutely need to have
For
if
sure.
you're going to continue to receive healthcare safely in a world that is social distancing and work from home. And with most clinics shutting down to physical appointments, it really has become the only viable option.
What would you say the current landscape in Canada for virtual care looks like right now?
Over the last couple of years, we've seen some good innovation in this space, but it's primarily been with what I would call virtual walk-in clinics.
Yep.
But it's really been more of a gradual adoption by Canadians. But because the world changed on all of us so quickly, there's now this very, very rapid catch-up that's covering many more aspects of health. So as I mentioned, virtual walk-in clinics have been popular. But now you'll see this on with family physicians and clinics. They're starting to offer virtual care visits, and this has been supported by the government, who really relaxed their rules around this. And then beyond primary care, you've got a lot of allied healthcare professionals. It started with psychologists; they would have been the early adopters. But again, now in this environment, you see this spreading in many, many, many more practices. Things like physiotherapists, audiologists, naturopaths, and many more.
That's interesting. And given all of this and what we know about the landscape to date, what is Lumino doing to kind of help with that and deliver virtual healthcare to Canadians?
So it starts with the fact that we help Canadians find virtual healthcare. So through Lumino Health, any Canadian can find and book a healthcare professional that offers virtual care. It could be a psychologist, a physiotherapist, or a naturopath. In addition to that, we help Canadians to understand the virtual care options and feel comfortable in using virtual health care. That could be by creating articles, videos, different ways that they can use virtual care. And then finally, we're enabling the healthcare providers themselves to conduct virtual care. So we partnered with a company called On-Call Health. It's a secure virtual care platform, and we're bringing that to enable many more healthcare providers to deliver their services virtually.
Another question I just thought of as you were speaking was, what do you think it is that is a barrier, I guess, if someone's never used virtual healthcare before?
Good question. I think it's more of a mental roadblock, because if you think of a telephone as technology, no one would be uncomfortable picking up the telephone, talking to their doctor or any other healthcare professional. There's something about video that and people hesitate. Maybe it's the technology. Is that going to work and all that? But what we're hearing and what we're finding is once people use it once, they're very comfortable. In fact, it gives them more options than they would have had before, which gives them better access than they would have had before.
What do you think is going to change coming out of all of this? What's your prediction for how that landscape is going to look like?
I think it will become a permanent part of the landscape. It's been around for a while, but adopted slowly. The crisis is going to force people to use it. But my personal belief is this will not go away. This will become part of the new normal, and it'll be an option. So, maybe I want to see my healthcare provider in person today, or maybe I want to see them virtually for 5 minutes. The other area I would say is going to open up over time is having healthcare providers come to your home. Right. It's all about access and having different choices around how you get your care.
If you could think of one thing that if somebody watching this video takes away and they only remember one thing coming out of it, what would that be?
I would say this is the new normal. There are many more options that you just didn't even understand existed in the past that'll make your life simpler and
Mhm.
easier. So I would say the big thing is try it out. I think you'll find that it's just as effective, and you're going to want to incorporate it going forward.